the way I describe it too is that the time to come and see somebody about an assessment or even for help with challenges you have with your child is just when you feel like you're out of tools.
Hi, everyone. I'm Dr. Shafer, your host of Talks with Dr. Shafer. I'm a physician, mom, life coach, musician, author, publisher, and I am passionate about using storytelling as a tool to help you claim your story and build your most beautiful future. And today I am so excited to be here with a very special guest, someone who does exactly that with families and patients with neurodevelopmental differences. Registered psychologist Leanne Tran is based in Australia, and she not only helps her patients and families through one-on-one visits with them, but she also has broader outreach through what she has created with workshops to help families and patients with neurodevelopmental differences, other programs that are available on her website, as well as her amazing podcast, Parent Like a Psychologist, which is just brilliant. Thank you so much, Leanne, for joining us on the show today. I'm so excited you're here.
You're welcome. Thank you so much for having me.
Your podcast is so brilliant and such a generous offer to families and patients with neurodevelopmental differences. I want to know, to start off the show, how did you come to the place where this is how you wanted to specialize in the field of psychology?
It's interesting to look back on those decisions you make, isn't it? I started out wanting to be a teacher when I was in high school, and at the very last minute changed to psychology. But I guess that idea of teaching has come through, and I think how I view working with my clients is teaching them about themselves, about emotions, about other people, and so that flavor's really come through. But I think when I was a child, I had a very mild condition in my hip that meant that I couldn't do what lots of other kids could do. And I think that has, I guess, put me on this path of wanting to focus on working with kids who aren't exactly the same as everybody else, and who, for maybe whatever different reason, can't do some things that other kids do, or feel left out, or something like that. And so I think that's had a way of shaping the types of kids and families I like to work with.
That's really beautiful. And I was wondering, how then did you decide to transition after you joined the field of psychology and working with patients and their families? How did you come to the decision to increase your outreach through your workshop and through hosting your podcast?
I think I've been working with kids and families for a long time, but what I noticed, I guess I've always seen that difference, in Australia anyway, between the support that people can access in a big city versus in a rural city. There are usually less options for families in smaller cities, but as you know, Australia is quite big as well. So there's lots of people living between those small towns. And it's even harder for those people to be able to access psychology. Sometimes I am in Brisbane, Queensland, in Australia, but do some work up in more rural towns in Queensland. And when I go to visit, sometimes people might have driven an hour or so to see me. And that's something that for an assessment is okay, but for that weekly support by seeing a psychologist, it's just the demand is too big on a family. And so by that's an experience I'd noticed over the years. But then since COVID as well, I think there was a lot of limitations to what people could access because there's more people seeking support and there's longer wait lists and just so many barriers in the way of bringing a child to see a psychologist face to face. And because a lot of the work I think I do is with parents to provide them with the skills in how to support their kids at home. I thought that was something that can be easily offered online after we all got used to Zoom through COVID. So it's just opened it up as an easier platform to connect with people.
Yeah, absolutely. Pardon me, clear my throat. So I wanted to hone in on something you said, because I think this is a concern that many of us have as clinicians when we're in this brave new world post-COVID and during COVID, and we were forced to see patients online for essentially everything unless it was a medical emergency.
Mm.
And then trying to figure out after COVID, we're of course still living with COVID, but we're in this post COVID / living with COVID world, and adjusting to how do we now weigh the benefits and the risks, the pros and the cons of in-person versus over Zoom versus remote care. And one thing that I do find comes up often is when you're doing therapy with children. So I think it's really interesting how you mentioned, the initial workup versus the follow-up workup.
Mm-hmm.
How do you balance that in person and remote when you are taking care of patients now in this post-COVID world?
I think what I'm finding is there's a lot of my work face to face is assessment work. I think
Mm-hmm.
because that's something that's incredibly difficult to do over Zoom or telehealth. I really need to meet a child first to really get to know them. Um, so I wonder if it's just been a shift in terms of that taking priority for the one to one work,
Mm-hmm.
and the rest being easier to do over telehealth. Uh, but I think too, it really depends on the child and the situation. And some children just don't connect over Zoom. I work with lots of kids who have ADHD as well. And so when they're quite young, they've got ADHD, it's a real challenge to be able to connect with them because the play is very different over a screen. You're not
Mm-hmm.
doing something together in the room. So I think it depends on the child and what their needs are. And
Mm-hmm.
probably also in terms of, I think you mentioned that initial work being face to face and then moving to the follow up being on Zoom. I think that's because a lot of what I do is about helping parents know what to do. And if parents are working, I can work with parents on Zoom quite easily after I've met their child. But the child themselves, sometimes that's tricky.
Right. I love that. And I'll jump ahead to that because that's something I really wanted to discuss with you that I read on your website, which is an excellent resource. I recommend that listeners go to the website and check it out. One of the links you have there says the quickest pathway to change and the dynamics in dealing with your neurodivergent child. And I wanted you to explain to us, to share a tip. What is the quickest way? And I suspect it has more to do, like you just said, about the parenting relationship than it does with quote unquote fixing the child.
Mm. Yeah, it is a little bit about the parenting relationship for sure. But what I mean when I say that, I think, is that when children are developing or have neurodevelopmental differences, there's often means that what they need is not aligned with how we would usually or traditionally parent. And so, for example, when children have ADHD, there's differences in how they can use working memory and how they can manage their time and that kind of thing. And so there are definitely ways that we can teach kids these skills, but that is the long way. And the quickest way, I think, is for parents to learn how they need to adjust things to better suit their child um, in the home, particularly. So, an example
Mm-hmm.
for that is using visual information because to support working memory challenges and to use timers to help their kids be able to get ready and out the door for school in the morning. So,
Mm-hmm.
if it's the quickest pathway to not so much change in the child's skills, but change that leads to a happier, calmer, harmonious home, which is, I think, at the bottom of what all parents want.
Exactly, exactly. And they don't necessarily have the education or the skills. They haven't been taught that one of the things they can do to create that environment is to decrease the stress. I think sometimes the urge is to fix the problem, but
Yes.
I think we all know none of us wants to be fixed. We want to be seen and
Yeah.
accommodated,
Yeah.
reasonably accommodated for what our needs are. And that's when we feel safe and loved.
Yeah, that's right.
So you work with not only patients with children to help them, but you also work with families to help educate them and support them. You mentioned ADHD and you mentioned some brief things that you could do to help with the morning routine. What are some other things that you help patients and families with ADHD, let's say in the teenage years, to help them learn how to cope better with their lives?
Yeah, I think your point about decreasing the overall stress in the family is a really good one. And that's, I think, one of the goals, because when kids have a lower baseline of stress, it takes more to push them into that overwhelm. Whereas if their stress is running high all of the time, they'll flip over into overwhelm a lot easier. And that's the bit
Mm-hmm.
that's hard to manage. Some of the things I work on with, I guess your question about teenagers is interesting, because teenagers are different to children, and there's lots of normal changes happening at that time where teenagers want to become more independent and do things on their own, and they're even not quite ready for that, but they want to do it anyway.
Mm-hmm.
So there's lots of the basics about skills to use to try to support those neurodevelopmental differences in ADHD. So things like, working memory not being great, perhaps problem solving or emotional regulation, and all of that kind of stuff. But also, I try and work with parents on understanding how to partner with their teenager. So, making that shift between that traditional parent role when our kids are little to being more, taking a more coach like approach. Uh,
Mm-hmm.
but then also, it's about how to problem solve together and negotiate boundaries and rules together. And also, I try to help with families to partner with their teenager to talk about the accommodations that help at school, and so that their teenager can advocate for what they need for themselves, because that sets them up to then do that in university or further study and jobs and that kind of thing.
I love that
Yeah.
focus on working with the family and with the patient on problem solving, because sometimes if they come to you as a teenager, that's maybe they've been getting by in school, but as more and more structures imposed upon them and they can't mask, they can't overcompensate for it at this point, and they kind of come off the rails.
Mm.
It would be wonderful if we systematically and just culturally were better at helping teaching problem solving many, many years before to our young
Yes.
ones, rather than teaching control and coercion, right? Like
Mm.
you're breaking down, you're not following the rules, you're not meeting my expectations. So now it's my job to make you fall into line is kind of a traditional old style parenting method, but it doesn't really teach the child anything about regulation.
Yeah, that's right. I think too, because yeah, you're right. It doesn't teach them anything about regulating themselves. All it teaches is to kind of push the emotions down. And that unfortunately makes them more likely to burst out later, leading the child into more trouble. Um, but I think too, with the problem solving, I think lots of times, particularly teenagers as well, they actually have better ideas on solving problems than we might have as well, because they know why they have trouble keeping to the boundaries that we set or the expectations we have in place. So homework's probably an easy example. If they're having trouble getting their homework done or leaving assignments till the last minute, they usually have the insight to know why. And if we
Mm.
try and just impose our solution, we miss that understanding they have. And it means that we're often off the mark in terms of what we suggest as our solutions.
Mm-hmm. So
Yeah.
just
And
like with
probably
everything else in communication, it comes down to listening.
Yeah, that's right. But I think that you're right that it can happen from a lot sooner. Kids, it's not just teenagers who understand themselves and their problems, but kids can as well if we, um, you know, encourage that process.
I love that. If you allow them to come up with the solution and allow them to test the solution, allow them to
Yeah.
fail. Let's say their
Yes.
solution maybe wasn't the best or they need to tweak it, allow them to edit it. This is the first draft. Let's see how it works. And that empowers them that they have control over their decision making and that they can fail and they can try again and the world's not going to end.
Yeah, that's right. And that's essentially what problem solving is, isn't it? Trying a solution and seeing if it works and refining it from that feedback and learning from that for next time. Yeah, it's a great
Yeah.
life skill.
So, when you have a child in your life who has neurodevelopmental differences, you may yourself not have the coping mechanisms to deal with that from the beginning. And you're just always in a state of stress yourself because you haven't
Hmm.
learned how to just be in the moment. And you're thinking of all the other times you had this problem and you're just trying to make it stop. You're getting a bit historical when you're in the moment. And I think one of the best things we can do for our kids is to try to stay in the moment with them and focus on the problem and not focus on the emotions. Allow the emotions to be there, give them their moment, but
Hmm.
we let them have their moment, but we're not going to sit with them and snuggle them. We're going to deal with them, put them where they belong, and then move forward. We don't have to stay in this dark space.
I think that's right. And one of the things I talk about a lot is mindfulness but also in parenting, because sometimes when you described it really well when you were saying that as a parent of someone who's neurodivergent, sometimes the stress is always there and you're focusing on lots of the challenges or maybe your worries. And what can really help is using mindfulness in your parenting. So, sitting with your child to do something that you both enjoy, or even if they just enjoy it, you'll enjoy being with your child. And because I think that helps us focus on the here and now and the positives and that connection that really sets up the relationship to work well.
Mm-hmm. I love that. Bring it back to the connection, not the correction, which I think as parents we feel like it's our duty to correct, right? And
Yeah.
to be the example. But I think our primary duty is really to connect and to model that regulation if we can, but we have to learn. And that's where you come in and what you provide families that are struggling with this.
Mm. And I think that's partly my drive in doing this as well, is that we research shows that being a parent of someone who's neurodivergent, but particularly ADHD, is the one of the most stressful parent experiences you can have. And it tends to, you've mentioned a few times about parents learning the skills as well. And that's really important, because what works for typical kids in their parenting doesn't really work with kids who are developing differently. And so it's of no fault of the parents that they're out of their depth with it. And yeah, so teaching just how they can do it a bit differently is really helpful. I like to try and make that distinction that it's not really teaching about parenting either. It's about teaching the skills that they can use, because their parenting is fine. It's just about how, what particular skills they can use that will be more effective.
That is so interesting. And I think you've said in a different discussion, you've mentioned how when you have someone with who is neurodivergent, who has neurodevelopmental differences, there's often a parent who also has neurodivergence. And
Yeah.
so if they've never been diagnosed, if they've never been made aware of the skill sets that they can learn, services available to them, resources, they also may not understand how they're showing up in those moments.
Yeah. Yeah. I think particularly for parenting in this generation, because of what you said about that traditional parenting role is to, or even teacher role really, of that coercive and control approach, that there's lots of parents now who never learnt as a child how to handle things like emotions and all of that kind of stuff. And that's for typically developing people. And then there are neurodivergent parents as well who found it even more hard to know what they're meant to be doing, how to regulate their emotions and interact with the world. And then now they're in this position of trying to guide a child through it as well. It can be really challenging. So I find often when uh, parents are learning about their child and what can help, they recognize that that would have helped them as well. But it's still something that they can put in place now. And the thing that we're talking about, these skills that parents can learn, they can help all children as well, or everybody in the family. So it's not that it's not that they're only useful for kids who are, neurodivergent. So learning these skills and ways of doing it then can help everybody in the family or everyone in the classroom even. And in fact, maybe make it easier for everybody. So there's lots of advantages in learning how to do it. And I try and take the approach too that's really um, like to just be kind to ourselves as parents, and for clients to be kind to themselves about it. We judge ourselves as parents too often already. So why not just focus more on, what we can do from now on that's going to make things easier.
I love that. Focus on the connection, the problem solving, the here and now, and where are we going to go in the future so that we are a cohesive family, that we're just showing up the best we can every day. We're making mistakes. As we said, making mistakes is absolutely normal. It's developmentally normal activity, and learning from them. So when you talk about, you know, judgment and we think about shame, I think there are some people who suspect that their child may have neurodevelopmental differences, and they have certain expectations about what happens when you seek assessment and care.
Mm-hmm.
They have experienced certain things in their lives, or they have read or learned about things that may or may not even be true about what happens when you seek assessment and treatment. Could you tell the audience a little bit about what you see as the pros and cons potentially of seeking care, and just help us understand what people can really expect when they are considering talking to their pediatrician or their child's teacher about an assessment?
Yeah, I think too, it should be fairly consistent across our countries, even though there's lots of other differences. But um, the approach to assessment seems to be the same. I think, first of all, the way I describe it too is that the time to come and see somebody about an assessment or even for help with challenges you have with your child is just when you feel like you're out of tools. You've tried what you know and you don't have anything left to try. It's worth just talking to somebody to see if there are other things that you can learn. But in terms of assessment, I think too what parents often struggle with is knowing what is normal and what's
Mm.
whether their child what they're experiencing is normal development, because we know that's a big range, or whether it's something to be concerned about. So the first benefit that parents can get is just talking to somebody who knows a lot of kids, has worked with a lot of kids, or even can do some questionnaires or assessments that can help find out whether what your child's doing is within that realm of typical or not. So you might get a lot of reassurance even from that first
Mm.
meeting with a psychologist.
Mm-hmm.
I think what I talk about with parents too, though, is that the benefits of it are really about understanding for the child, a self awareness and self understanding.
Mm.
And so that's that's got such a great benefit, whether they end up going on to meet a diagnosis criteria or not. Learning about ourselves is one of the best ways that we can then live our best lives. And so that is a gift that you're giving your children to learn about themselves, how they operate, to help them know how to connect with other people. Um, but it also gives you awareness as a parent of knowing how your child's working, how they tick, so that then you can use the strategies that are going to work the best with your child as well. There is
Yeah.
a bit of stigma still around, isn't there, which is so unfortunate.
I think parents really worry about that.
Mm,
And, something that you said about awareness, and I think, it's scary to become self aware, but once we become self aware, the gifts of that are obviously plentiful and
yeah.
incredible. And we love to be seen, right? We want to be seen and understood and assisted. And how do we help people to feel that this is a benefit to their child and not, focus on concern about stigma, help them get over that hump to see the potential benefits, even if their child comes home with a diagnosis that may be hard to accept to begin with, the
Mm.
benefits of them having this awareness that maybe explains things, how they're showing up in the world, so that they feel seen and they can now access new tools to help them move forward.
Yeah. I think it is a hard thing to overcome sometimes, that worry about it. And I think being reflective of why you have those feelings is a useful thing. Sometimes it's shame, or yeah, usually shame, maybe from the messages we got from our parents about keeping things private or that
Hmm.
kind of thing. So maybe reflecting on where you feel like that hesitance is coming from, what messages you might be, hearing in your mind, and are they really coming from you, or are they the judgments of others? But then judgment as well comes from everybody anyway. I'm
Yeah,
thinking so often
exactly.
of the parents who tell me about when their child's having trouble with behavior. Usually it's in a supermarket, and there's a woman behind them who's kind of tusking under a breath, or, you know, thinking, oh, obviously you're not doing parenting right. That judgment is around us
Hmm.
anyway. So I think it's a good thing to always try and put off other people's judgments or let it fall off you, because those people judging your child for their behavior, they don't know your child, they don't know you, they don't know what you've been trying to do, they don't know how successful it's been. Um, so trying to put off the judgment of others is a really good strategy, I think. And to
Yeah.
just be that fierce parent in the way that's the protector of your own child. So sometimes putting off the judgment of others so that you can do what you think is best for your child takes a lot of courage. Um,
Yeah.
yeah, but I think
It
that's
does.
what I would probably recommend. It's funny as a psychologist because I don't feel that stigma because it's what I do all the time. So
Hmm.
yeah, I don't know if I'd have better advice than that.
No, I think it is about judgment. And I think it cycles back again. We talk about how it's so important for us as parents to understand self-regulation and our own emotions so that we can show up the best in these challenging moments when we are dysregulated. How can we try to remain calm and remain, not become unmoored? And it's similar to when your child is losing their cool and you staying regulated, staying in the moment, staying connected with them. The same if someone is around you in your orbit and they are trying to influence you in a negative way, just staying focused and staying connected, because not only is their judgment not helpful, right? So is it necessary? Is it helpful? No, we don't need it, especially in this moment of crisis.
Hmm.
But we have no idea what coping skills they have. You wouldn't
Yeah.
take criticism from someone you wouldn't take advice from, and you have no
Yes.
idea where they're
Yep.
coming from.
Yep. Absolutely. That's such a good um, rule to live by, not to take criticism by people you wouldn't from people you wouldn't take advice from. Yeah.
Yeah.
The other thing that's occurred to me too was that, seeing a psychologist, there's lots of um, like professional standards and boundaries around that where it is private and confidential as well. So people
Mm-hmm.
don't need to know that you're going to see a psychologist for some advice and an assessment for your child. Um, yeah, it's not something that you need to share with the school, with extended family, or anything. You can just decide that that's something you want to do as one step towards finding out a bit more about your child and how they operate. And once you're comfortable, you get to choose when you share that information with other people.
That is such a wonderful point to make, because I personally have heard people who weren't really educated on the topic balking at their children receiving therapy for a variety of, reasons, that were bringing the child to therapy and saying, um, you know, well, this is going to follow them on their record the rest of their life. How can you make this decision for them? And that's not accurate. And
Mm,
I think when you leave someone to cope with their challenges alone because you're afraid of how this one little data point that no one's ever going to see might look, that's calculus that I can't make sense.
yeah, I have similar conversations with colleagues here too, and agree that it's sometimes we worry for what the future might bring, but if we let that stop ourselves from dealing with what the challenges are now, then yeah, it doesn't really stack up. I think the most important thing is dealing with the how things are currently, and optimizing that, because that really is going to have more input into your child's future than lots of other. I don't know if I've said that properly, but our fears are for whatever's going to happen in the future, but really what we do today is what's going to shape how that future pans out. Yeah.
Exactly. We have more control over it than we imagine.
Yeah, that's right. And it's here it's often the case for something, for example, in being in the military. I don't know if it's the same in the US, but parents might worry about that it might preclude their children being able to do something in the military. If, for example, they do
Hmm.
have ADHD, or if they have a diagnosis of anxiety or something like that. But the way I look at it is that without understanding and supporting those challenges now, the chances of your child making it to that point are changed anyway. So you're much better off
Exactly.
just focusing on what support your child needs now, and let the future kind of take care of itself.
Exactly. Because we don't know exactly what it will look like. what it will be, but we do know that if we show up for our children the best we can today, that gives them the best chances for the future. I absolutely love that.
Yeah.
Could you tell listeners a bit about the programs that you do online that help increase your outreach, the workshops?
Yeah, I think I have a few programs in mind, which I'm just seeking the time to create. But at the moment, I've got a program called Supporting Your ADHD Teen. And so that's a lot about what we call in the psychology world psychoeducation. To a parent, that sounds weird sometimes. But
Mm.
it's lots of the education about around the psychology of ADHD and of parenting. And so that's designed to be for parents who might be, they have a child who has ADHD and they're just wondering what they can do to put in place at home to support their child.
Mm-hmm.
And it could be people who are on a wait list for a psychologist as well, because what we often start with is education on different psychology topics. And so it might be a course that parents do that then is all they need to have that happy home they're looking for. Or it might be the start of putting in place strategies, but then they might need more support later on. But at least then, while they're waiting for a psychologist, they're not lost for that whole time as well. They're learning things and putting things in place. So that ADHD program's available all the time. The other one is about it's a more hybrid approach where there's online learning, but also some weekly sessions as a group to kind of work through the challenges of parenting kids who are different in a range of ways. And so that might mean if they are autistic or have ADHD or learning challenges or giftedness or a combination of all of those things. That's where the parenting becomes quite tricky, I think, because you've got to change lots of different things in different ways. And so that's designed to be so that people can access that even if they're in a rural place in Australia. Um, and yeah, don't need to rely on being able to see somebody in person for that.
That's amazing. And it sounds like not only are they receiving your services, but it's also similar to a support group and they're forming bonds, hopefully with other
Mm.
parents that will then potentially even stay with them as they continue on their journey because they're not going to be a part of this program forever. It's going to
Mm-hmm.
be for a distinct period of time. And I wanted to ask you that kind of along the similar lines of how when we're seeking treatment, if we've made the decision that we want to seek treatment for a child that we suspect has these challenges and could benefit from an evaluation, assessment, and potentially treatment, a big question people have is, so what does this mean? What can I expect with regards to how long we'll need to do this? They might be thinking, oh, Bobby's really busy and we're going to be doing baseball and we're going to be entering this grade and it's a lot of driving and all of that. So there are just so many reasons people might try to convince themselves to not seek care. So I think it might be
Mm.
helpful to give people an idea of what to expect, how often they may need to be seen or how long, depending upon what the underlying issue they're seeking help for is.
Yeah, that's a really good question. And when we're talking about something like mental health, if it's a child who might have anxiety, it may be around 6 to 8 sessions that they're working with a psychologist for. Um, and then after that, maybe just check-ins every couple of months, or maybe even not at all if parents are able to handle that on their own. So it can be a lot shorter than people think. When neurodevelopmental differences are different in the way that they're there for, they're kind of, it's how your child's wired. So it's going to be a part of their life ongoing. that doesn't mean that the support needs to be then weekly forever. um, when I work with families, it's more about setting a goal about what would you like to, one problem or one or two problems at a time to work on,
Mm.
um, and then thinking about how to address that for that period of time, upskilling parents to do lots of stuff at home in the meantime. And then your child might need some more support a couple of years later, or maybe not at all, depending on how their life goes. But it's usually good to have a couple of sessions in a row or bunched together in the beginning, so that the child can really get a sense of what's happening, and with the frequency, really you get a head start on a lot of those skills. But it might only be for a couple of months, and it doesn't need to be every week. It could be fortnightly. That's what we say in Australia, sorry, for every second week. I don't know if you have a different term there.
Well, now we all know the word fortnight thanks to
Yeah.
Taylor Swift.
Oh, really? Of course. I didn't think about that.
Everyone now knows. No one knew a few weeks ago, but now we know.
Yeah, that is true. Yep. She's done everyone a service.
She has. She has.
Yep. So it might only be, say, maybe around 6 sessions to get a real handle on these things. Um, And depending on the age of your child as well, you could do it monthly. If they're a teenager, is probably frequently enough. But I think what your point about having, so I would say you don't have to be concerned you can't fit it in your life because of other things. You can usually work with your psychologist as well about finding out a pattern of sessions that's going to suit you. But it is a good point to make, to maybe choose a time when, as a family, you're not incredibly stressed and busy. So kids
Mm.
always have sports, so that's something you can probably work around. But if you're
Yeah.
moving house, if they're changing schools, that's probably not a great time. But
Mm-hmm.
otherwise, it's a good way to think about it as life. You know, with sports, there's practice, and then there's the
Mm.
game. So this is a good way to think about it, like it's practice for life. It's just that training session that you might have once a week or so, for a little bit, to really get some good skill development happening. And then the requirement for the sessions is less, as the kids are able to put those skills in place on their own.
That's amazing. That's an amazing way to put it. And it's so true. So there are the sessions, and you talked about the online workshops that can be available. And we've also discussed things like support groups, which I think for parents can also be really, really valuable too. You've also mentioned on your podcast other resources like wonderful books that you recommend people
Mm.
read. What are some other resources that you share with families and patients to help them with coping?
Um, I think there's books is a common one. I think that's because I read a lot. That's my preferred mode of learning. But there's also lots of podcasts is a great one, I think, because we're usually in the car a lot, parents.
Yeah.
So using podcasts to listen for, like, just particular topics of interest is a great thing. Otherwise, there's lots of websites around, particularly organisations that are designed to help kids with particular developmental differences, so ADHD, autism, or learning challenges. They've got lots of good websites around for that. I know these are all general because I'm thinking about the differences between Australia and America here.
Right.
But the information's the same. It's usually just the
Yeah.
names of the organizations that are a bit different. Yeah.
Absolutely. Absolutely. And how do you feel about the school's role? So, our kids, most of them are not going to be involved in therapy. And some of them may never actually see a pediatrician. more of them are going to see the school system at some point in time, we hope,
Mm-hmm.
for their education and assessment. How do you feel the system does at identifying people who could benefit from the resources of a psychologist?
I think in Australia it varies a lot school to school, but um, and probably a little bit in terms of a child's behaviour as well. So I
Hmm.
think there's lots of great resources in a school, which is great, and they can often do. We have guidance officers here who are like school psychologists who can do assessments for a range of different things, which is great because it's less of a financial burden for families as well.
Hmm.
And I think they're quite good at picking up learning challenges for kids. But like anything, the more severe a challenge is, the more likely it's going to be picked up.
Hmm.
So, what might be missed is more of those mild challenges because kids can seem to struggle and then they catch up a bit and then they struggle and it's harder to pick up. And so, then for things like that's probably true for autism as well. For things like ADHD, I think they're probably better at picking up the kids who are more visible or perhaps disruptive in the classroom. But the kids who are more inattentive and kind of zoning out and looking out the window, they're not causing trouble in school. So it's
Hmm.
harder to pick those kids up. And that's, I think, where it varies teacher to teacher. Some teachers are really um, on the ball and can have taught for a long time, or even just very what we would call psychologically minded, of kind of
Hmm.
being good at reading each individual child and picking up the ones who seem to be struggling for some reason. But
Yeah.
schools are a great option for that like counseling or psychology support as well, because your kid's already at school, they've got time to do it. And if they're struggling at school with things, then having the support at school within that system is actually a really helpful thing.
Hmm. I think it's really a valuable takeaway as well to say, even if a teacher has not pointed out a concern, suggested an assessment or a counselor, but you have concerns, not to second guess yourself,
Yeah.
but to request the assessment because you really know your child. You
Yeah.
see milder things, milder symptoms or challenges that maybe, like you said, because of the schedule, the skill set, because of other distractions in the classroom, they may not be picked up. And you need to trust yourself as a parent. And if you feel like an assessment is warranted and that's something you want to pursue, don't second guess yourself. It's okay to ask for it.
Yes. That I would wholeheartedly second that advice, that your intuition as a parent about what's not, I wouldn't say that, because parents say to me often that they get this sense something's not right. And
Hmm.
I think it's not that there's something not right with your child, it's just that something's not sitting right with you as a parent,
Hmm.
or that you feel like your child's not quite, maybe the support is not right. But definitely listen to that gut feeling and ask for the assessment if you are unsure. Yeah, great
Yeah.
advice.
Oh, thank you. You mentioned a moment ago the differences between, the inattentive versus the hyperactive child with ADHD. And I think, that also brings to mind the difference between your average female youngster
Mm-hmm.
with ADHD versus male youngster with ADHD. Can you talk about the differences there and how, again, we as educators, as parents, as loved ones in these children's lives, how we can maybe pick up on things better, knowing that there may be differences in how these children present?
Yeah, I think it's kids. I mean, like you would know, where there's no hard and fast rules with girls versus boys, that sometimes
Right.
girls present in that more typical boy way than Yeah, so it's they're all about generalities, but in
Mm-hmm.
general, girls tend to present as more with that inattention type, or with if they've got yeah, which means that maybe sometimes they get misdiagnosed and they might be seen as anxious rather than having
Hmm.
attention challenges. Also, girls tend to, if they are more hyperactive, having impulsivity, maybe they say what they think before thinking it through. Sometimes it can appear as social challenges as well. So it's easier for girls to get, I think, either not diagnosed or not picked up or misdiagnosed as having other challenges than what's at the bottom of it. So that's a really good example of when it's good to go and see a psychologist who can look at, we take a really broad view of everything that's going on and
Mm-hmm.
then narrow it down to work out exactly what's happening for your child. Um,
Mm-hmm.
but so if you're noticing, yeah, that if you're noticing a few challenges, seeing somebody can help you work out exactly what's underlying the challenges. That's what psychologists are good at looking for. It's not just the behavior, but it's what skills or challenges are underlying that behavior that can lead us to better understand what's happening for your
Right.
child.
Behind the emotion is the need.
Yeah, that's right. Yep.
Yeah,
I think
exactly.
the other thing with girls too is that they can tend to learn a lot of coping mechanisms fairly well, whereas that's something that more typically boys don't necessarily do. And so, an example for that is with ADHD, and they've lost, they don't understand what's happening, but they're a little bit better at looking around and working out socially, okay, this is what everyone else is doing, so I'm just going to do that.
Hmm.
And they can kind of blend in a bit because they're good at, yeah, using their social skills to pick up what they should be doing.
Yeah. And that's something that we hear a lot right now, kind of on even on things like TikTok and on Instagram about this phenomenon of masking. And I'd be very
Mm,
curious to know your feelings on this as someone who's dealing, with this, who's helping with this generation and their parents who also may have some of these neurodivergent features as well, when we are taking a step back and we see all of these people coming forward and saying, I am newly diagnosed as a 30-year-old woman
mm-hmm.
with autism, right? With mild to moderate autism. And I never knew I had this, and I was excellent at masking, but something felt not right. As you said, something just, they had anxiety because the way that they were trying to engage with the world wasn't turning out the way they hoped time and time again, and they
Mm.
didn't understand why. Do you have any thoughts behind why there are so many people in this age group? I would say between, 20 to 40 even, that are
Mm.
now coming forward and realizing that they actually have had autism, but they've been masking and just coping all this time.
Yeah, I think what you mentioned about that, um, it leads back to what you were talking about before about how people of that generation, or I'm saying it like I'm in that generation. Actually, I'm beyond it. I'm a bit old, but um,
No,
how we
come
were
on.
all taught yeah, to manage emotions was different. And I think there's a lot more acceptance now and awareness of managing emotions and how to do it in
Mm,
a healthy way. So that gap, I think, between what people are doing now for children and what they were doing back when these adults were young is different.
mm-hmm,
Um, and I think then sometimes too that there's those ongoing traumas, like you mentioned, of not knowing how to respond or what to do, and having maybe some negative consequences or reactions from that
mm,
makes it harder, and it's more likely then that people will kind of mask and try to fit in, and all of those things kind of accumulate over the years. It's almost like layers on upon layers of the masking. Um,
Mm-hmm.
and so now I'm finding lots of times when children are presenting for an assessment, parents will often say, I was exactly like that at school. That's exactly what I was like. And so then they're starting to recognize some of those signs in themselves as they go through the process with their children. And we know things like ADHD and autism are genetic as well. So
Mm-hmm.
chances are it's more common that a parent will have those differences as well, but it's that they
Mm-hmm.
haven't been uncovered until now. I don't know
Yeah.
if it's the same in the States either, but here in Australia, people with disabilities often were lived in out of the family home in homes
Mm-hmm.
together. And so often I think what happened too was those people from age 20 to 40 weren't necessarily around other people who were autistic, um,
Mm-hmm.
who were removed out of the community. So it was a little bit
Mm-hmm.
difficult to see that um, diversity, whereas these days it's easier to see the diversity, I think, a bit more as people are in mainstream schools and with their families still. So
Mm.
there's more awareness of the full spectrum of being human and all of the differences that it can contain.
Yeah. And I think so when I see someone diagnosed and they're talking about, basically coping with the traumas and coping with this new knowledge, but also this feeling of relief, of self-awareness.
Mm-hmm.
I think also if they have children, my hope for them would be that they could, once they sort through what I call that messy middle of coping with something really deep and
Mm-hmm.
potentially really kind of shaking to your life and your consciousness, once they get through that messy middle part and they realize, I'm okay, and now I'm learning new skills to move forward, and they're finding that peace in their life, I hope that then they can look at their children and understand how full their lives are,
Mm.
and have that hope also for their children if they can also learn these skills and teach them to their children that these differences are a part of who they are, and they are still going to be developing humans and giving amazing things to the world.
Yes, definitely. And that's where I think that self identity comes in, that it's really a really healthy thing to have strong self identity and
Mm.
belief in yourself.
And to see, as you were mentioning, to see people who have all different abilities
Mm-hmm.
in your day in, day out life, and really just have an idea for the fullness of the human experience and build a community based on that. It's interesting because I was having this conversation with my husband recently. He's Czech. And we were actually discussing how in the Czech Republic during communist times, they also had a similar experience where anyone who was not um, able bodied to, do the difficult work, in
Mm-hmm.
the factory, in the bakery, all of that, they were just, if they had any sort of neurodivergence or physical ailments that made it so they could not participate, they were potentially removed from public life, and they
Mm.
lived in communities and no one would ever see them.
Mm.
And it's really just so unfortunate, again, because you have generations of people that don't understand the full breadth of the human condition.
Yeah, yep. I think that's when, as soon as you said that, I thought it's interesting that potentially that's where some of that shame comes from for families as
Mm,
well. That, yeah, either that the, we don't see, or parents don't see kids like their own kids
mm,
amongst everybody else, or potentially too, if it's that they've had people in their family who may have been um, gone to live in other places as well, because some of these things are genetic. So there may be those family stories about that impacts how willing parents are to seek help as well now. Some of it
yeah.
can be subconscious as well. So, yeah, really. But I think my encouragement for parents would be that things are really different now. there's been a lot of change over the last 20 years, for sure, in terms of how we're working with neurodivergent kids, and yeah, to just see it as a way to help your child with their own self-identity. And that's going to be just such an amazing gift you could give them for the rest of their lives.
Absolutely. And I think seeing yourself in other people is also really important.
Mm.
And one thing that as I learn more about neurodivergence in culture, in politics, in the world, right? All of these people who are neurodivergent, who made incredible impacts on our world. I mean, I think many of the most impactful human beings that have ever walked this earth were neurodevelopmentally different in some
Mm-hmm.
way. And those differences allowed them potentially to maintain a focus that would be otherwise unworldly
Yeah.
and achieve things in their fields that maybe someone else just wouldn't decide to be so focused on, right?
Yes. Yep.
And I think it's really important to celebrate our differences, and when our differences present challenges, to know the resources. And that's why I'm so excited that you're here and talking about the resources that you provide and the
Mm.
books and podcasts that are available to families to help them cope with the challenging moments, but also to remind them, you know, the world is full of people who have these different abilities, and they are making it a much more full and beautiful world than it would be if we didn't have them as a part of our world and our culture. So I really want to impart that on people. And I so appreciate the work you do to help people feel empowered and aware so that they are living the best life that they can.
Yeah. Yep. That's a great way to sum it up.
Mm. So tell us a little bit about your podcast, because that's another resource that people can access for free online. It's brilliant, and it's very connecting. And in fact, I did want to say I love what you say both on your website and in the tagline for your podcast. You say, "Come
Mm-hmm.
on in." And I just
Yeah.
love that.
Yeah. I find I say that it's how I start every session with saying, greeting people when they're there to see me in my room. Come on in. So it's the same idea. It, it's designed to be as welcoming as that, because it doesn't matter if we're seeing each other in person or not. It's the same process that I'm using. Yeah. And the podcast, I think, is another way I thought is great to be able, for parents who can't access a psychologist for whatever reason. Sometimes it's financial as well, wait lists, or your location. To be able to access information is still really important. And I think the topics I talk about are often based on the questions that parents have for me. And I figure
Mm.
that they're not the only ones having these questions. So, yeah, one person asks it, then we can all benefit from the answer.
I love that. I love your generosity with taking the time to share that and make sure that it is accessible, and the, equitable nature of that. I think podcasting is just such a brilliant way to share your expertise with people, and I'm so grateful for you coming on this podcast to do so today. Could you
Mm.
share with our listeners resources, how they can reach you, your website? Let us know how people can get in contact with you and learn more.
The podcast is called Parent Like a Psychologist, which is not meant to be, it's meant to be, just a title about, I guess, how I do my parenting, rather than that everyone has to parent like me. Um, my website is a good place for people to find those courses, and I do a blog from the podcast episodes as well. So that's leannetran.com.au. Or on Instagram, Leanne Tran Psychology is another place to find me as well. Whatever's your easy mode of connecting with the world as a parent.
That's that's awesome. And I highly recommend that you do follow, subscribe to the podcast, Parent Like a Psychologist. The episodes are brilliant and connecting. And as soon as you hear Leanne say, come on in, you feel so safe and welcome. And isn't that exactly what you want when you're trying to learn about sometimes these really challenging things that you're coping with
Yeah.
in your day-to-day life? And that's just so beautiful and connecting. And I'm so appreciative that you take the time to share that with listeners. And again, I'm so appreciative that you took the time to be here with us today.
Oh, you're welcome. I'm so glad thankful that you had me as well. It's always amazing to connect with people who have the same kind of vision to share information like this.
It's so important. And obviously, you're passionate about it too. And I'm just so glad we connected. And I'm
Yeah.
so glad that our listeners are here today. Thank you so much for coming and being a part of this show with us. If you have questions, you can certainly contact the show at www.drshaferstedranova.com. And please, you can also contact Leanne. She is also available on her website as well. So
Yes.
please let us know if you have questions, or on Instagram. So let
Yep.
us know if you have questions about the show or if you want to connect. We'd love to hear from you. Please stay safe, take care, and I'll talk to you soon.